We received a lot of evidence that an ageing society raises some big questions about fairness in our society. And we are clear as a committee that government has to think about these, clearly, as do all political parties. The welfare state has always worked, by and large, that you pay into the welfare state when you're young and you get your big benefits from it in terms of pensions and health care when you're older. That's how it was designed, and by and large, that's right. But with a lot more older people, it's not going to be simple to think that all of the costs of an ageing society can be borne just by younger taxpayers. And therefore, there is a difficult issue, but we think an important one, that older people themselves, as we know, will want to and look to support themselves as much as they can. But that will include at times, as was recommended by the Dilnot Commission and as government accepted, use the value of their own finances to support parts of their own caring. And we think that that is right and is necessary, because otherwise someone else will have to pay for it, and you can't put all of those costs onto a younger generation. There are also big issues for women. The evidence we received from the committee, I think for some of us, was an eye-opener, that women's experience of ageing is quite different from men's. By and large, women have much worse pension positions because their working life patterns were different, or their husband had a defined contribution scheme, which meant the pension ended when the husband died. And women tend to live longer, therefore they often live in isolation, and it is often women who are the predominant users of health and social care in later lives. So these are issues that government and policymakers have to think about seriously. Do our policies and services work for women as well as for men in later life?